And we are going to be speaking to Dr. Eunice Ohinintim, managing cold and flu, the prevention and treatment strategies. Doc, you're on the line. Good morning. How are you?
Good morning, Nana. I'm doing well. How are you?
I'm blessed by the grace of God. Thank you very much. So as I said, or I mentioned earlier, we're talking about prevention and treatment strategies for cold and flu. But let's get a brief before. What is the difference between having a cold and having the flu?
That's actually a great question. And sometimes you find people using these terms interchangeably. But technically, a cold is an infection that is caused by a virus, specifically the rhinoviruses, and usually comes with symptoms like sneezing, runny nose, and the like. And the flu is a viral infection that is caused by another group of viruses called the viruses. And when this happens, you find that these people will have the symptoms of the cold in addition to muscle weakness and fever and the like. So they have similar presentations, they are not necessarily the same.
Okay, right. So, why is it that they become so common during certain seasons? I mean, when it's a little bit cooler in Ghana, you see that the instance of, and Hamatan as well, you see that the instance of colds and flus like increase. Can you tell us a bit more about why that is, please?
Well, yes. When the weather is cooler, it has been found that usually it is difficult for the white blood cells in the body, which are responsible for your immune response, to work the way they work when the weather is less chilly. And this is because the blood vessels that supply these cells become narrower, so it is difficult for the nutrients that they need to reach them. You would even find that in the more temperate regions where they have 4 seasons, and they also have a high incidence of the cold and the flu during the colder times. And it is also true that when the weather is dry, the viruses are able to thrive more than when it is not. So that has been the trend usually. When the weather is dry, when the weather is chilly, you would find increases in these presentations as well.
Okay, and how do these illnesses spread from person to person? Just so that people are aware. Some may know, but just so that from a doctor's perspective.
Okay, so usually you would have these colds and flu spreading to people when they are in close contact. You can have it spreading through small droplets. So when you are close to someone and you are speaking to the person, or you breathe or you are singing, you find that you naturally produce a small droplets which could carry these viruses and pass them on to other people. It is also why if you have a cold, it will not be kind to be very close to a baby, for example, because then as you breathe and as you do normal things, you'd find that you would transmit these viruses to these infants who may not have an immunity as strong as yours. And then the larger droplets may be transmitted when you sneeze. So you actively see that you produce a spray of fluid or liquid when you sneeze. And that is another means by which you could transmit these viruses. And then usually contact with surfaces, you'd find that usually when these viruses are on hard surfaces, like tables, like your ATM card, your car keys, your phone, light switches, these viruses can stay on these surfaces for up to about 7 days. So when you are interacting with these surfaces, it is also possible that you'd pick up these viruses. So that's usually how they spread from person to person.
Okay, and though we are going to talk about prevention shortly, is the best way to stop the transmission of these illnesses to use a mask, or what's the best way to stop it from moving around so quickly?
Well, a nose mask is a healthy way of preventing the transmission. As I said earlier, through large droplets and small droplets, you have the virus is transmitted. So when you have a nose mask on, it reduces the chances that these sprays would land on the skin or the face of the other person. But the surest way to prevent the cold and the flu is hygiene, hand washing. A simple hand wash with soap and water will trap these viruses in small bubbles that can then be rinsed off the hand with the running water. So that's one of the surest ways to cut your chances of getting a cold or a flu. In addition to that, if you are well rested, if you sleep a lot, like you have a healthy sleep, you are likely to reduce the chances of getting a cold or a flu. Quite interestingly, it has been found that people who sleep less than 5 hours of sleep, are 3 times more likely to get a cold or a flu than people who have more than the standard 7 to 8 hours of sleep per day.
Oh, okay.
So yes, it is also a very important factor to look out for. If you sleep well, you are able to manage your stress well, you are well rested, you drastically reduce the chances of getting a cold. Nutrition is also important. If you have a good diet routine, which is rich in vitamins that are known to a healthy immune system, like vitamin A, vitamin C, and vitamin D. So talk of foods like your citruses, lemons, oranges, and your carrots and tomatoes, which are rich in these vitamins A, C, and D. You boost your immunity and then you reduce the chances of catching these colds. Because these colds, in as much as they are typically mild, they can be a bother, especially when it is causing you to miss time at work, and it reduces your productivity and all. So you do what you can to prevent it from coming in the first place.
All right, but Doc, on the flip side, it seems that men suffer more acutely from cold and flu than women. Is that true? Is it just that women push through,
so?
or you see, you always hear about man flu?
And in fact, I am not aware of that, and I am not sure there have been any studies yet to show the correlation between the frequency of flus and in males than in females. So,
Okay, so what are the typical symptoms of flu versus the typical symptoms for a cold, so that people are aware that maybe if they start seeing these symptoms, they will start maybe putting some preventive measures in place?
that's a good one. Usually with a cold, the symptoms are milder. So you'd have your runny nose or your stuffy nose, you'd have sneezing, and you may have a cough. The symptoms are usually concentrated in your nose and your throat. But with a flu, the symptoms are much more severe. So you could have the runny nose, the stuffy nose, the sore throat, the cough. But then in addition to that, you could have a fever, and then you'd have muscular pain or bodily pain as well. Unfortunately for us, sometimes we mistake those symptoms to be malaria. So we have a cold, and then we have fever, and then we have body pain, and then we erroneously assume that it is malaria. But sometimes it really is not malaria. It could be a flu, which is an infection on its own that can be managed without having to treat for malaria. So that's the difference between a cold and a flu.
Okay, so are there any complications that can come from having a cold and a flu?
Yes, actually, In fact, especially in children of school-going age, the daycare children who happen to have these colds often, you find that sometimes when the colds are not properly managed or they don't go completely, they um, develop into a more serious infection of the ear, for example, or of the lungs. And sometimes it can even lead to a worsening episode of asthma if the person is already asthmatic. Sometimes it can lead to pneumonia. But fortunately, if the cold is properly managed, if the cold or the flu is properly managed, it's usually mild and you don't have these complications occurring.
Okay, so if somebody has maybe seen that they've got symptoms of a cold or symptoms of a flu, can they self-medicate, or what's the best thing to do for them?
Well, there are traditional remedies that have been proven to be helpful for colds in general. And because colds are typically mild, and it's usually your immune system that does the job. You can support your immune system at home with these remedies, and within 10 to 14 days, you would recover. And it becomes quite problematic if after 14 days you are not seeing improvement, then you may need to seek medical attention. But during the early stages, the milder stages, you do your steam inhalation. So you boil a lot of water and put it in a bucket, like our mothers and our grandmothers usually do for us. You sit on a small stool and then you cover yourself and the bucket of water with a thick blanket, and then you inhale this steam, and it helps to moisten your nasal passages to make the nasal passages less conducive for these viruses. And you find that when you do this for about 3 nights, you find yourself improving. If you are doing something like hot water with lemon and then honey, that is also a fine remedy that you can use. That can also help you to recover better. At the pharmacies, we usually recommend vitamin C and supplements, and then these cold and flu preparations, like they come as medicine. You have them right for cold, for flus on them. There are also fine medications that you can take, that you can get over the counter at pharmacy. But traditionally, colds are mild, and even if you don't do much, they should resolve on their own.
Right, so what's the best way, other than that you've mentioned wearing a nose mask, good hygiene, hand washing, good rest and sleep patterns, and managing our stress and nutrition? What other ways are the best ways to prevent getting a cold and a flu, especially in these dry and cold seasons, as you mentioned earlier?
Honestly, those are actually the best way. Top of the list is hygiene. If you have a proper hygiene system, regular showers and regular hand washing, and you cut the chances of getting cold by as much as 80%. That's the surest way. And that is very important because colds traditionally don't have a, a medication for treating them the way you would have maybe an anti-malarial medication for treating malaria. You wouldn't find something like that for cold. So when they come, you support your body and then they pass away. But the best way to manage them is to prevent them from coming in the first place by being on top of your game with your hygiene, your diet, and your nutrition.
Meaning that sanitizers also will help reduce transmission.
Yes, that's a good reminder. You see, washing your hands is the surest way because you are actually ridding your hands of these viruses that could be on your hands. And you use the sanitizers when you do not have access to water and soap. And it has even been shown that if you are using the sanitizers regularly and you are not washing your hands as you should be, your chances of reducing the cold are not as effective as regular hand washing.
Oh, I
So in
see.
cases where you don't have access to these water and soap, you can go for an alcohol-based sanitizer that contains at least 70% of alcohol. But top of the list is hand wash with soap and water.
Right, now there's the flu vaccine. How effective is it, and who should use it?
And the flu vaccine is actually quite an interesting concept. And this is not very mainstream in our part of the world. Usually in the temperate regions where they have the winter, they take the flu vaccine annually, and it reduces their chances of getting the flu. The flu, as in the flu that is associated with fever and muscle pain. But in our part of the world, we do not have the flu vaccine. Although studies are being conducted to find the relationship between our Harmattan weather and flu, and then the role of the flu vaccine, but it hasn't been fully rolled out yet in our part of the world.
Right, now let's talk about natural and medical treatments. A lot of people prefer to use natural products and herbs and things like that to cure cold and flus. I know that my mum, for prevention especially, she boils the skin of pineapple and pawpaw and says that it staves off fever. So what are the benefits of this, and how effective are they versus traditional medicine?
Well, they work. They work, and especially the ones I have mentioned earlier, the steam inhalations, the hot tea, they work. Because all you are doing is supporting your body to recover quickly. Anything that gives you relief, it reduces your symptoms, it makes them less severe. It's a fine thing to do. Garlic, for example, is very good because of ability to reduce inflammation. It's a good addition. Honey, as I mentioned, eucalyptus. Eucalyptus is also a fine herb. If you are able to have a tea that contains eucalyptus tea is also fine. Thyme, the thyme herb is also a herb that you can try if you have these cold sources. And then, as I mentioned, with the traditional medicine at the pharmacy, we have different brands with different medications you can get over the counter that are not necessarily herbal, but they can also give you the symptomatic relief that you need. So these all work, but the most important thing is to support your body and support your immunity.
Right, so can you catch a cold or flu from just being out in the rain or in cold weather? Is that really true?
Well, you see, the cold is caused by a virus, not necessarily the weather. And so if you have exposure to the virus, that is how come you're going to get a cold. But it is not necessarily the cold weather. Although when you are in a cold environment, it reduces the immunity that you have and makes you more susceptible to getting the viruses. But it's not the cold weather itself that is causing the cold. So it is fine sometimes to let go and play in the rain, just a little bit.
I'm sure the children are happy that you have said that. So when should people seek medical help? I know that we mentioned over the counter, we mentioned home remedies and things like that. But when should we go to see the doctor? At what point should we go and see the doctor?
Okay, so the natural progression of the cold is 10 to 14 days then. If you should become exposed to a cold virus, the course of the infection is about 14 days. You have a small minority of people who have a cold lasting longer than 14 days. For many people, too, they get the cold for about that 2-week period, and then they have a cough that lasts slightly longer than the 14 days. So if you have this in mind and you have the cold, you start a supportive therapy, you would find that you're seeing some improvement. Within the 14 days that you give yourself, you should recover. However, If you are seeing that beyond this 14 days, you are not getting better, that's a sign that you should prompt medical attention. Additionally, if the symptoms are associated with a wheezing sound or a persistently high fever or severe weakness, severe body weakness, that is quite unusual, then it is also a danger sign that you should seek prompt medical attention.
Right, thank you so much. So what's your top advice for staying healthy so that we can stave away from cold and flu in this season and beyond?
Okay, let me summarize them in 4 things that I have said. For the surest prevention of colds and flus, a good diet rich in vitamins A, C, and D, hygiene, regular hand washing with soap and clean water, and with a sanitizer if you don't have access to those things, proper rest, proper sleep, and being able to manage your stress very well. That's the key. And the last thing will be healthy, moderate exercise as regularly as you can within the day. If you're able to do this, you'll be among the top 25% of people who are living a healthy life, and it will be quite unlikely that you are going to get a cold. And even if you should, you are going to recover very quickly.
Doc, thank you so much. So we must make sure that we have a good diet, we engage in good hygiene, that's hand washing with soap. And if you don't have soap and water, then you can use 70% alcohol sanitizer. Get good, proper rest and sleep, and manage your stress. And most importantly, or one of the most important things of the 4 that she mentioned, healthy and moderate exercise. Ghanaians don't like exercising. So we must do all we can to get ourselves out there and get ourselves pumping for, I think, at least 30 minutes for 3 times in a week. I've been told that that is good, healthy, moderate exercise. But Doc, can you give us your social media handles, your location, your telephone numbers to be able to get in touch with you, please?
Okay, sure. So I actually work with Draxa Therapeutics, and they are responsible for the manufacture and distribution of supplements, including those that are responsible for helping with stress management. So on social media, especially Instagram and TikTok, we are Draxa.therapeutics. Our DMs are always open, and if you need to reach me specifically, you can reach me on TikTok, Draxa.therapeutics.
Can you spell that? Can you spell that for us, please?
All right. So Draxa is DRAXER. Draxa dot therapeutics. THERAPEUTICS. Draxa.therapeutics.
Right, that's Draxa.therapeutic, and that was Dr. Eunice Ohini-Ntim, who was helping us with how to manage cold and flu and giving us good methods for prevention and treatment so that we will stay healthy, we will keep with good diets, and we'll be able to do all that we can as life presents itself. So Doc, thank you so much for your time. We're really grateful.
Thank you, Nanama. It was a pleasure to be with you.
Right, that was Dr. Eunice Ohini-Ntim speaking about colds and flus. So we are off with that, and we will move on to something else.